Share on Pinterest. If you live with anxiety, you've probably come across some of the many claims surrounding the use of marijuana for anxiety symptoms. Plenty of people consider marijuana helpful for anxiety. A 2017 national survey trusted source of more than 9,000 Americans found that 81% believed marijuana had one or more health benefits. Nearly half of these respondents listed anxiety, stress, and depression relief as one of these potential benefits. But there also seems to be just as many people who say marijuana makes their anxiety worse. So, what's the truth? Is marijuana good or bad for anxiety? We've rounded up the research and talked to some therapists to get some answers. First, a note about CBD and before getting into the ins and outs of marijuana and anxiety. It's important to understand that marijuana contains two main active ingredients, THC and CBD. In a nutshell, THC is the psychoactive compound responsible for the high associated with marijuana. CBD is the non-psychoactive compound that's used for a range of potential therapeutic purposes. Learn more about the differences between CBD and THC, how it can help. There's no question that many people use marijuana for anxiety. Many clients I've worked with have reported using cannabis, including THC, CBD, or both, to reduce anxiety, says Sarah Peace, a licensed counselor in Olympia, Washington. Commonly reported benefits of marijuana use include increased sense of calm, improved relaxation, better sleep. Peace says her clients have reported these benefits along with others, including greater peace of mind and a reduction in symptoms they found unbearable. Peace explains her clients have reported that marijuana in particular helps relieve symptoms of agoraphobia, social anxiety, post-traumatic stress disorder, PTSD, including flashbacks or trauma responses, panic disorder, phobia, sleep disruptions related to anxiety. With Peace sees in her practice is on par with most of the existing research around marijuana and anxiety. A 2015 review trusted source supports CBD as a potentially helpful treatment for anxiety, particularly social anxiety. And there's some evidence that THC may also help in low doses. How it can hurt. While marijuana appears to help some people with anxiety, it has the opposite effect for others. Some simply don't notice any effect, while others experience worsening symptoms. What's behind this discrepancy? THC, the psychoactive compound in marijuana, seems to be a big factor. High levels of THC have been associated trusted source with increased anxiety symptoms, such as increased heart rate and racing thoughts. In addition, marijuana doesn't appear to offer the same long-term effects as other anxiety treatments, including psychotherapy or medication. Using marijuana may offer some much-needed temporary relief, but it's not a long-term treatment option. Other things to consider. While marijuana might seem like a way to avoid the potential side effects associated with prescription medication, there are still some downsides to consider. Negative side effects. These include increased heart rate, increased sweatiness, racing or looping thoughts, problems with concentration or short-term memory, irritability or other changes in mood, paranoia, hallucinations and other symptoms of psychosis, confusion, brain fog, or a numb state, decreased motivation, difficulty sleeping, smoking risk. Smoking and vaping marijuana can lead to lung irritation and breathing problems, in addition to increasing your risk for certain types of cancer. Plus, vaping is linked trusted source to a recent increase in potentially life-threatening lung injuries. Dependence and addiction. Contrary to popular belief, both addiction and dependence are possible with marijuana. Peace shares that some of her clients have a hard time finding a line between medical use and misuse with daily or regular cannabis use. Those who use it frequently to numb themselves or keep from caring about the things causing them stress also often report feeling like they are addicted to cannabis, Peace says. Legal status. When using marijuana, you'll also need to consider the laws in your state. Marijuana is only currently legal for recreational use in 11 states as well as the District of Columbia. Many other states allow use of medical marijuana, but only in certain forms. If marijuana isn't legal in your state, you may face legal consequences, even if you're using it to treat a medical condition, such as anxiety. Tips for safe use. If you're curious about trying marijuana for anxiety, there are a few things you can do to reduce your risk for it worsening your anxiety symptoms. Consider these tips. Go for CBD over THC. If you're new to marijuana, start with a product that contains only CBD or a much higher ratio of CBD to THC. Remember, higher levels of THC are what tend to make anxiety symptoms worse. Go slow. Start with a low dose. Give it plenty of time to work before using more. Purchase marijuana from a dispensary. Trained staff can offer guidance based on the symptoms you're looking to treat and help you find the right type of marijuana for your needs. When you buy from a dispensary, you also know you're getting a legitimate product. Know about interactions. Marijuana can interact with or reduce the effectiveness of prescription and over-the-counter medications, including vitamins and supplements. It's best to let your healthcare provider know if you're using marijuana. If you don't feel comfortable doing this, you can also talk to a pharmacist. Tell your therapist. If you're working with a therapist, make sure to loop them in, too. They can help you evaluate how well it's working for your symptoms and offer additional guidance. The bottom line: marijuana, particularly CBD and low levels of THC, shows possible benefit for temporarily reducing anxiety symptoms. If you decide to try marijuana, keep in mind it does increase anxiety for some people. There's really no way to know how it will affect you before you try it. It's best to use it cautiously and stick to smaller doses. Other non-medical treatments can also help relieve anxiety symptoms. If you're looking for alternative approaches to treatment, consider giving other self-care approaches a try, like yoga, breathing exercise, meditation, and mindfulness. Approaches it may take some trial and error, but with time you can find a treatment that works for you. Crystal Rapole has previously worked as a writer and editor for Good Therapy. Her fields of interest include Asian languages and literature, Japanese translation, cooking, natural sciences, sex positivity, and mental health. In particular, she's committed to helping decrease stigma around mental health issues.